Clinical depression is terrible. I'm not downplaying other conditions, but with other conditions, it's like Jamie has a broken arm and Jamie is in pain. With depression, Jamie's gone. It's like a sickness of your soul. It's devastating. And depression rates are high and getting higher. Before COVID, over 20% of those in the US are thought to suffer depression sometime in their lives. And rates are particularly high in teens and young adults. But just the first few months of COVID in early 2020, in the US, over 40% of respondents struggled with symptoms of depression and anxiety, and 11% seriously considered suicide. So depression is a big problem, and we're not very good at dealing with clinical depression in our society. We like to throw drugs like SSRIs at the issue and think that'll make it all better. But many of the traditional treatments, honestly, are not very good. Tests show that SSRIs, such as Prozac and Zoloft, they're no better than placebo for mild to moderate depression. And although the ads for depression show that, oh, all it is you have low serotonin, and here's your serotonin, now you're happy, that's really not what's going on. There's no evidence that those with depression have low serotonin. I also believe that serotonin isn't just one thing. I think there's a lot of different types of depression that have different underlying etiologies, different manifestations. So one size does not fit all. Now, one thing that may underlie many types of depression is a lack of neurogenesis in the hippocampus. That's just development of new nerve cells in the hippocampus. And things that hurt your nerve growth in the hippocampus, stress. And stress and depression are closely tied. Now, things that help it, learning and exercise. Now, exercise, that's a toughie. Because trust me, you never want to go up to a friend who has depression and say, oh, go take a walk, you'll feel better. They may throw something at your head. It's not helpful to just say it that way. But the reality is, if you're depressed, taking a walk may actually help. So maybe the key is how you word it. Maybe say something like, I miss you and I need my friend. Please come take a walk with me for 10 minutes. And if they say no, don't take it personally. Depression is tough. But exercise really may help depression. Now, we're at a place now where we're really starting to learn the value of other treatments for depression, other than just the strict traditional pharmacological treatments we've been using for a while. Meditation, clinical studies show, is at least as effective to treat depression as SSRIs are. Ketamine. Ketamine was approved by the FDA in 2019 and provides rapid relief for depression. Most of the other SSRIs take 3 to 4 weeks if they work at all. Ketamine can work within hours. Doesn't last as long, but it can get somebody out of a severe depression faster. Psilocybin, that's magic mushrooms. Early clinical trials suggest that these may have some antidepressive properties. And we're not sure the mechanism. It might be because they're anti-inflammatory. It might be because they actually increase neurogenesis in the hippocampus. And it might be because hallucinogens like LSD and psilocybin alter the connections in the brain. So they strengthen some connections and they decrease activity in others. And I like this analogy. Imagine you live in a city and you only talk to the people in your neighborhood. You only have connections with the same people all the time. And those people tell you you suck. And they tell you you have no friends, nobody likes you, and they give you a bad message all the time. And then let's say you stop that connection and you step out of there and you go connect and communicate with other parts of your brain, of your neighborhood, of the city. And you get a very different message when you connect with other parts. And that might lead you to have new perspectives and different ways to look at yourself and look at the world around you. And that's kind of what hallucinogens do. They stop some connections and they build connections with disparate parts of the brain. And that can make users feel more connected to the whole, the one, the universe, the all, and it gives them a different perspective on themselves and their place in the world. So the take-home message for the day, I think, go be kind to somebody, because you never know what struggles somebody is dealing with.